Let's focus on this common enemy, and that's my message. So this is a message for the whole world, and a message that this is a common enemy that we can only defeat if we do it in unison. And we need to use the window of opportunity that we have now. And that's why I said it could spark a bigger fire. This is only a window of opportunity, and we should really work hard as one human race to fight this virus before it gets out of control. One humanity against a virus which we don't know very well. It attacks any human being. This is a common enemy. I said it many times.
If you can pull out the chair from inside.
We can have a chair here. On that side. Thank you, Tariq. Good afternoon. 40,235 confirmed cases in China and 909 deaths. The overall pattern has not changed. 99% of the reported cases are in China. A lot of people are asking, where is the outbreak going? Is it getting worse? We're doing several things to answer those questions. First, the meeting on research and innovation starting tomorrow. Second, an advanced team of WHO experts has just arrived in China. We're grateful for the many people who have volunteered their expertise from all over the world. In recent days, we have seen some concerning instances of onward transmission from people with no travel history to China. The detection of this small number of cases could be the spark that becomes a bigger fire. It's only a spark. Our objective remains containment. We call on all countries to use the window of opportunity we have to prevent a bigger fire. Without vital diagnostic capacity, countries are in the dark as to how far and wide the virus has spread. WHO will continue working with all countries to prevent and detect rapidly new cases of coronavirus and to save lives. I thank you.
Hi, this is Liu from China's Xinhua News Agency. Two questions. Sorry. One question.
They have synthesized the virus? I didn't understand. Question. Can you repeat just the question, please?
Does WHO know that or had any comments on that?
Okay.
I think a number of labs have isolated the virus now around the world, so I think, and are actively sharing the virus as well. Presence of the antibodies to the virus, which will allow us to look at population attack rates, not just look at who's been infected and who's been sick, but to potentially look at a broader proportion of the population to see if there are milder cases out there that we're not detecting. So there are huge lessons to be learned from that experience. But immediately, obviously, understanding better issues around the origin, source of the virus, issues around severity of the disease, answering all of those questions. And we believe that many of the ongoing investigations, which are actually being implemented by Chinese scientists, are getting those answers. That this is an investigation to learn and support China.
Thank you very much. Are you inviting experts from Taiwan to be here in Geneva, epicenter of the outbreak? But they had limited access. They weren't allowed to go to the market, for example. Are they going to be physically here in Geneva? Are you inviting them? Thank you.
We will have a number of Taiwanese colleagues online as the conference is greatly oversubscribed. So we have to be very careful in bringing scientists together that we don't disrupt the response itself. So a lot of colleagues from around the world are both coming in by WebEx, by telephone, and will be online for the deliberations, multiple teleconferences, and we continue to engage Taiwanese colleagues and colleagues on the Chinese mainland in all aspects of technical cooperation in order to better understand this disease.
Thank you very much for that question.
What we have now is a better view of how many people are have mild disease. It's around 80%. How many people are of a severe disease, mostly a pneumonia that requires hospitalization? From the latest data, it's around 15%, and also it's around 3 to 4% of people who will need 3 to 5% of people will need intensive care. When you compare with SARS, we have also to recognize that since SARS, the medicine has done a lot of progress.
The health system in China is sophisticated and is capable of delivering high levels of intensive care.
I'd like to go back to the case of that happened in France and the recent cases. How concerned are you that we may be seeing a super spreader emerge?
Way too early and much more of an exaggeration to consider the Singapore conference event a super spreading event. Conference cluster has 12 cases associated with it. But certainly it is always a concern when people come together and then move apart. Slightest possibility that there may be possibly an infection associated with nCoV that we're going to cancel every event. Otherwise we cancel these press conferences and we wouldn't be able to speak to you. So where is the limit to this? So I think we need to remain calm, we need to be measured, we need to be driven by risks. First, we need to identify those risks and look at those events one by one and say, okay, what are the risks? How can those risks be minimized? There is no zero risk in anything in life. You may trip on the stairs going out of here. It's a risk. So I think we need to take a risk management approach, accept there's no zero risk.
And I think also what is very important is to talk about super spreading event and not people.
The advanced team is already there. And they will prepare everything for the rest of the team. And we hope the rest of the team will join them as soon as possible. Of course, they will have a plan. Where? They will have a plan. They will organize a plan based on the discussion with their counterparts. What to visit, when to visit, and where to visit, and where to focus, what kind of issues, which unanswered questions to answer. Thank you.
Shane from China Central Television. I also have
Exactly the same answer I will give you. Experts are fully powered to, operate based on, their expertise. Yeah. Thank you.
This mission brings together the best of Chinese science, Chinese public health, with the best of the world's science and public health.
You're fully powered. You're the experts and working very well with their, of course, counterparts in China. So work as experts and see what they can see. Tomorrow's meeting, one thing we would expect is, again, they should be free to say whatever they think based on the unknowns we have. There are some people from some corners who would like to politicize it, and politicization will not really help us. This is a common enemy. I said it many times. Let's focus on this common enemy against humanity. It attacks any human being, one humanity against a virus which we don't know very well. And in my speech, I said there are cases now, onward transmission that are worrying us. Small cases cannot be a guarantee. Even infection starts from one. And that's why I said it could spark a bigger fire. And we need to use the window of opportunity that we have now. This is only a window of opportunity. And we should really work hard as one human race to fight this virus before it gets out of control. And that's my message. But this message is not just for China, it's for the rest of the world too. So this is a message for the whole world, and a message that this is a common enemy that we can only defeat if we do it in unison.
Kai, truthfully, no, we're not aware of that change. We will check it out, obviously, but no, we're not aware of any significant change to the case definition. Certainly not one that discounts lab confirmed cases if they're not some. No, we'll have to check that out and come back to you. It sounds strange.
Okay, thank you, and see you tomorrow.
You're doing the interview. That's all right. Then I'm happy. For you, I'll do it. I was about to say over my dead body, but if it's you, I'll sacrifice it once more. Don't ask me how I Otherwise, we cancel these press conferences and we wouldn't be able to speak to you. You may trip on the stairs going out of here. It's a risk.